Hi everyone, Dr. Brian Steiner here at Wilkins Spinal Care in Mount Pleasant, PA. This week we're going to continue down our adventure of the arm. We started with the shoulder, we then went to the elbow and the forearm. Now we're going to focus more on the wrist, hands, and fingers. So these are the most distal part of the upper extremity. So there's a lot of different conditions of the wrist, the hands, fingers. We're going to focus on mainly two of them. Big ones are arthritis, rheumatoid arthritis, osteoarthritis. Those are all common things. Those are things that we've discussed in the past, that it occurs in the same way as it would a hip or a knee. It's due to repetitious activity. It can be due to just wear and tear throughout your life. We're not going to focus on those ones. We'll focus on two other ones. But wrist, hands, and fingers combined, there's 54 bones between a hand. Or one hand, there's 24 bones. You have 8 carpal bones, which is your wrist. You have 13 metacarpal bones, and you have 14 phalange fingers, and the thumb included. So there's so many different hand joints. You have the radiocarpal joint, you have the metacarpophalangeal. It's all in the blog that I posted this week. I'm not going to go into each individual joint space, but because they all have different, some are hinged, some are saddle. The thumb's a ball and socket joint. I'm not going to go into great detail with that. I'm going to focus more on the conditions that we treat per se, but in the blog information that I sent out on Monday, that's all in there. So two different types of conditions I'm going to talk about in the video today. This first one is, it's not super common in a chiropractor's office, but it's trigger finger. Trigger finger can be due to overuse. I'll give you myself as an example. I don't have trigger finger, but I'm a competitive shotgun shooter, pulling my trigger or pulling my finger constantly. That could be the cause of it, but it's a repetitious thing. But they say in nature, it just kind of happens. It's when the tendons of the fingers become tight and swelling occurs. It causes your finger to bend a little bit. How do you treat trigger finger? A lot of people recommend stretching, some splinting. A lot of people do ice and heat, and that usually gets rid of it. But some patients can suffer with trigger finger for years, and in that case, you may require more intervention. Sometimes surgery is included. It is rare, but sometimes they need to snip some stuff a little bit to get everything to relax. But again, not as common in a chiropractor's office, but we have our Hockman therapy that we talked about previously that we use for neuropathy patients. We have used that on patients with trigger finger, and it actually works pretty well for them. So that's something to keep in mind in case you or someone you know has trigger finger. Last condition I'm going to talk about, a little bit more common, is carpal tunnel. So carpal tunnel, right in this area right here along the wrist. What is carpal tunnel? The wrist bone, all the wrist bones. I'm going to come into zoom and I'm going to show my hand. There's a sheath right here. Okay, you can bend, you can extend it. This here is called your flexor retinaculum. What the flexor retinaculum is, it's a sheath that covers your muscles, your tendons, your nerves. And what happens is with overuse, there's swelling. And what happens is that swelling causes narrowing of those nerves and the blood vessels, and that can experience the carpal tunnel problem. A lot of people at that point will say, I need to get carpal tunnel surgery. And what they do with carpal tunnel surgery is they snip that retinaculum, which opens up that space. It's almost like a laminectomy of the spine. And what happens is, over time, when that retinaculum reattaches and that swelling continues, that carpal tunnel comes back. Whenever somebody has carpal tunnel, they typically complain of arm pain that runs all the way down, causes numbness in the thumb, pointer finger, middle finger, and classically just the half of this ring finger here, okay? The reason why is because it affects what is the musculocutaneous nerve, which sits right up in this area here, C6, C7, and it runs right. Here's the musculocutaneous nerve. It goes right there from the brachial plexus, okay? So what do you do to treat carpal tunnel? Again, a lot of people will go the surgical route, but in 85 to 90% of cases, it's a nerve issue coming from the neck. So this is something we've talked about several weeks in advance now. It's nerve interference. So what are we going to do with a patient with carpal tunnel? Again, that musculocutaneous nerve goes up there. We're going to adjust the neck, okay? Now, does that mean I'm going to not adjust the shoulder or the elbow or the wrist? No, I'll take a look at that. We adjust the wrist, we take a look at the elbow, we take a look at the shoulder, but in most cases it is the neck. And it really tends to help patients out a lot. So that's the biggest thing with carpal tunnel. You don't always need surgery. Does that mean that every patient that's come out of here, they're cured? No, some people actually do need that carpal tunnel surgery, and we're not afraid to say that. But most cases it can be handled with a neck adjustment. So that's all I have for you guys this week. Again, we only talked about 2 different conditions. I have a couple different conditions listed on the blog that I posted on Monday, and I also have the joints, the different types of joints in that area that we talk about as well. We're going to kind of steer away from the upper extremity now at this point. We're going to focus on some other conditions that we treat here in the office. But otherwise, that's all I have for you guys. If you have any questions, you can give me a call, and I'd be happy to answer any questions for you. Have a great day.